Well, hello, hello, and good morning. Good morning. This is Dr. Yonette coming to you with another episode of Baby Talk. How have you been? It's been a little while. Sometimes things get a little rocky and busy out here, but I'm always thinking about you. And this morning, I want us to continue to talk a little bit about feeding baby solid foods. We started talking that about the fact that when your baby turns 6 months old, you are beginning to feed your child from your family's table. And so there are certain foods that you begin to introduce to your child's taste, and it help your child to be able to eat some more solid food, some solid foods. Now, solid foods are really a complement to the breast milk that you're continuing to provide for your child. So today I want us to look a little bit about the child, how to deal with a child who is a picky eater, and then what foods to avoid, or how to prepare these foods so that you avoid choking in your child. So let's look at that a little bit. Let's start off with choking. Now, your baby is still learning how to eat at 6 months old. He or she might be curious and want to put things in their mouths, but he or she is still learning how to eat. And this is going to go on for the next 12 months to even 2 years. They're still going to be learning how to eat the foods that you and I eat as adults. So you want to make sure that in your food preparation, you cook and prepare your food in the right shape and the right size and using the right texture. Now, the information that I'm sharing with you comes from the CDC, so you can also go back and review on this video, on this podcast, so you can see exactly what you need to do. You want to avoid small, sticky, or hard foods that are hard to chew and swallow. And then, mealtime or snack times should be specially guarded and should be done in a way that promotes eating or feeding so that your child is successful with this activity. Have your child sit up while eating. No lying down, no crawling, no walking. You want your child to sit in a high chair or in a safe place. And you want to avoid letting your child eat in the car or in the stroller. Okay? Remember, we're trying to ensure that choking does not take place. You keep meal times calm and avoid the distractions, things happening everywhere and disruptions. You are rushing back and forth while you're feeding the child. Make mealtime a calm time, and always pay attention to your child and to what he or she puts in his mouth. Watch your child when he or she is eating. Remember, this is a new activity, a new skill that your child is developing. So be there and be ready to talk to your child's pediatrician if your child is choking, even when you have set up these parameters that we just discussed. Okay? So here are some choking hazards that you want to avoid when you are feeding your child. Or here are some potential choking hazards or foods that you might want to avoid that may cause your child to choke. Cooked or on raw whole corn kernels. This is in the fruits and vegetable category. Uncooked or uncut cherries or grape tomatoes. Uncut cherry or grape tomatoes. Pieces of hard or raw vegetables or fruit, such as raw carrots or apple, can cause choking in your child. And whole pieces of canned fruit. Remember, Uncut grapes, berries, cherries, or melon balls can be choking hazards, and uncooked dried vegetables or fruits such as raisins. So those are the hazards that you need to look at carefully. When we come to proteins, you want to make sure that or these foods may cause choking in your child. Whole or chopped nuts and seeds, chunks of spoonfuls of nuts, seeds, butters, such as peanut butter, even as adults, if you eat peanut butter in such a way, you can end up choking. Tough or large chunks of meat, hot dogs, meat snacks or meat sticks and sausages, and large chunks of cheese, especially string cheese, can cause choking. Bones in meat or the fish can cause choking. And then we have whole beans that can also cause choking in your child. Now, when we come to grains, cooked or granola bars can cause choking. Potato or corn chips, pretzels, popcorn, or foods that are similar can cause choking in your child as well. Crackers or breads with seeds, nut pieces or whole grain kernels can cause choking, and whole grain kernels of cooked barley or wheat or other grains. You need to look out for those along with plain wheat germ. And then for sweetened foods, round or hard candy, avoid candy. I would say all the way up until your child is about 5. Candy is not even necessary. If you don't have to, do not introduce sweets like candies, artificial sweets like candies to your child. Jelly beans, caramels, gum drops, gummy candies, avoid those. Chewy fruit snacks, chewing gums, and marshmallows. The United States Department of Agriculture gives this list for infants and children so that you can avoid these foods because they may cause choking in your child. Now, this list is just an initial list. You want to also continue your journaling. We talked about journaling repeatedly. Continue your journaling so that you can get the kind of information you need to keep your child healthy and protected. Now, your child may not like every food that you give to him or her on the first try. So you want to give your child a chance to try foods again and again. And this is especially with children who tend to be picky eaters. You want to make sure that you're giving your child the opportunity to develop that taste for the foods that you're introducing to him or her. So here are some tips to help you make help your child try foods again and again and making it easier. Try to freeze small bits of different foods. And when you do that, you'll be avoiding throwing away foods so that you can use the foods that you freeze a little later. You don't want to give it frozen like that though, but freeze them so that you preserve them. Wait about a week or so before you try a new food again. Try that particular food that your child is avoiding again. So give the child the food today, wait 7 days, bring it back. You also want to try mix new foods with the food that your baby likes, such as breast milk, right? So you're introducing this food and your child is totally not having it. Mix it up with some breast milk. But as your child gets older, he or she might start refusing foods that he used to like. So you want to start when you start seeing that your child is showing signs that he might be a picky eater, you want to start flavoring the foods. A couple of foods. Let me say this again. If your child is favoring a couple of foods and not wanting foods that everybody else is having, these behaviors in children can go on until about 5 years old. Now, here are some tips that you can use to help your child. Try the food again. Like I said earlier, wait about 7 days and then bring back the food. It can take about up to 10 introductions before your toddler might like the particular food. So keep trying. Don't discard the food after your first or second try. And then, like I said earlier, mix up the food with foods that your child like mix these foods with breast milk. And then be silly. Have lunchtime or feeding time or snack time be a happy time. Make funny faces with the food so that your child can see and engage and become excited about eating these food. We used to do like airplane drives, or car drives, and then get the food right into the child's mouth so that the child eats what you're presenting. You're kind of, distracting the child and getting the child excited. And then you want to look at Me Too. Try eating the food with your child. And then, put a piece in your mouth and give your child a piece of the food. So we are having an interaction while we are eating. And then look at the choices. Give your child different choices of foods to try. And let your child decide on which one he or she wants to eat on that particular day. Food time should be a happy time for your baby and, be in the family. So don't let it be a time where you are fighting with your child and you must eat and you don't get up from this table until your plate is cleared. Let it be a fun time, and you start establishing those rules when your child is young. So have a happy time feeding. Have an awareness of what your child likes and what your child needs, and be intentional about avoiding those foods that will be choking hazards to your child. As you take care of yourself, as you become knowledgeable so that you can take care of baby, and as you give yourself the best care, you'll be the best provider, the best mom and dad for your children. So today I encourage you to take care of yourself as you take care of your baby, and have a great time feeding your child. This is Dr. Yonette saying thank you for joining me today, and I look forward to seeing you again tomorrow.